And welcome back to the WHHI Daily News. With us now is Dr. Johanna Contreras. She is with the American Heart Association. And what we're talking about today is heart disease, particularly with Hispanic women. There's an interesting statistic, 43% of all Hispanic women have cardiovascular disease. So, Dr. Contreras, why is that?
I know. It's a combination of factors. So it's alarming. Yeah, we have a lot of women with heart disease, a lot of Hispanic women. I think we have a genetic predisposition that we're still understanding more and more every day. We also have inequities in healthcare. So a lot of Hispanic women do not have access to preventive healthcare. So unfortunately, a lot of women came to us when they are pregnant. And many times when they get pregnant, it's the first time that they have an interaction with the health system. And that's when we start diagnosing, oh my God, you have high blood pressure, you have high sugar, you have cholesterol. So unfortunately, that's why I think it's one of the contributors to the increase in maternal mortality in Hispanic women, because a lot of these diseases that could have been prevented or treated or controlled before pregnancy happen during pregnancy. And not really, when it happens during pregnancy, they are more difficult to control, and they can put the women, the mom, and the baby at risk of complications like infarct, stroke, cardiomyopathy, blood clots, pulmonary embolism, and also you can have worsening of hypertension during pregnancy all the way to preeclampsia and eclampsia, and you can actually put the mom and the baby at risk for death.
Dr. Contreras, how would a woman know if they have cardiovascular disease? How would she know?
So it's complicated. So one thing that I tell my patients is, if you have family history, in your family runs high blood pressure, diabetes, and cholesterol, and a lot of our Hispanic family that happen, it's important that you go to your doctor. And any woman that wants to get pregnant or thinking of getting pregnant, go to your doctor and know what are your risk factors. And understand what your blood pressure, what your cholesterol, what your sugar, what you have diabetes or no. Because many times we can control those factors, as I said, before you get pregnant, and you can be a healthy mom as you get pregnant. Also, if you have those factors, you can tell the doctor you're trying to get pregnant, because many times we have to use different medicines in order for you to control the risk factors, medicine that will not have any problems in the baby, so you can actually use that medicine during the pregnancy, and you can actually have a healthy pregnancy. So many diseases we don't have feelings, like they call the hypertension like the silent killer, because many times you don't feel anything. By the time you feel something, it's too late. Right. So we want to prevent the problems that the disease can happen.
So what are some of those steps to prevent heart disease for women?
Number one, know your numbers. So any woman, and a lot of women, for all your listeners, it's very important that these women take care of themselves. They take care of everybody else, they need to take care of themselves. Number two, exercise. It's very important that we involve exercise in our daily life. 30 minutes of exercise a day is very important for cardiovascular health. Diet is very important that we learn how to cook our foods, what we like to eat, our culture food. I don't want people to stop eating what they like, but they need to learn how to make it healthy, how to make it, avoid processed food, avoid fried foods, avoid sugary foods, because they can increase the risk of really overweight and diabetes. Avoid smoking and alcohol if you're trying to get pregnant. Sleep is important to sleep well. The 8 hours of sleep is significant, and it's important that the woman can rest and already can decrease the stress. So I think you have those healthy factors and you work in all these things to have the healthy lifestyle on top of controlling your disease. Because if you have hypertension and you can control the blood pressure, you can have a healthy pregnancy. You can control the blood pressure, you can control the diabetes, you can lose that extra pound that you have. And if you control the risk factors, you can have a healthy pregnancy and you can have a healthy baby. And more important, once you have the baby, it's very important that the women continue to control the cardiovascular health. Okay. Many women get lost post-pregnancy.
Yeah, very good. Unfortunately, we're out of time. Dr. Contreras with the American Heart Association giving us valuable information about, in particular, Hispanic women and cardiovascular disease and pregnancy. Thank you so much, and we'll be right back with more news.